Having a missed abortion or an incomplete miscarriage is bad enough. I understand that the last thing you want is a D&C or a curettage on top of that, with all the risks that those procedures can bring for your fertility as well. The good news, even in this bad situation, is that there are homeopathic remedies that can help your body to resolve the pregnancy naturally. Hello lovelies, and welcome to another one of my videos in which I'll be sharing a couple of homeopathic remedies with those of you that have a D&C or a curettage hanging above their heads. Now, this channel, I love to be super positive and talk about boosting your fertility, but I know that sadly, miscarriages is a huge part of many of your infertility stories here. So D&Cs are a big part of that. And I do get messages sometimes, and I do get new patients that come to me because they need help avoiding a D&C, and then they become my fertility patient. But it's just not possible to help all of you, so I thought that a video would be great, especially because perhaps you have been searching online, what can I do to get rid of this pregnancy before my curettage tomorrow or in 2 days or maybe even tonight. And I'm hoping that this way I can reach out to you and give you a couple of tools so that you have that opportunity. Now, it depends on where you are right now, whether these remedies are going to have an effect. They need to be the right remedies at the right time, and you need enough time for your body to pick up on the message to resolve this pregnancy. So don't see it as a miracle option, although it totally can be a miracle option, but see it as something that you should definitely try before you go into surgery, because you may already know that having D&Cs can increase your risk of getting adhesions and Asherman syndrome, and that impacts your fertility further. So although right now you might not be thinking about getting pregnant again because you're mourning the loss of this baby, this is something that you will want to do down the road. So I'm sure you want to set yourself up in the best way possible. So if you and I can avoid that D&C, I think it is totally worthwhile. And I also want to point you towards another video before I get into these remedies. That is a video I did a while back, and that is on pregnancy loss. I will link it up here in the cards and in the description as always. And I hope that I'll be able to encourage you a little bit in this super hard time. Now let's get into these remedies, shall we? So there are 5 remedies that I want to talk to you about. And at the end, I also want to share some remedies in case they don't work and you still have to go through the D&C. But we want you to have some remedies to reduce the risk of those adhesions and help you heal better. But I first need to explain to you how to take them. A lot of people know that homeopathic remedies, those are the little sugar pills, that the way to take them is you just put them in your mouth and you suck on it. And that is great, that is an option. But I think when it comes to avoiding a D&C or preparing for surgery, there's a much better way of taking it, and actually an easier one. And that is that you take 1 pill of the remedy and you put it in a bottle of water or in a glass of water, and that you sip from it at intervals throughout the day. That way you get the message of the remedy a lot more often, but you don't get the full impact of the pill every time. So it is a lot more gentle, and it is more like a coach that is alongside your body saying, okay, you know what to do. We need to do this, we need to do that, and just keeps encouraging your body. So all of the remedies I'm suggesting, I suggest for you to take it that way. It is also possible for you to mix remedies. A lot of homeopaths will probably find me blasphemous, but I find that this is really effective to do it this way. And I don't want you to be in the position to take 1 pill and then have to wait and nothing happening. When I feel that when it is an acute situation like that, just like fever or like labor, you need a more frequent dosage of that message of the remedy telling your body what to do, because your body knows what to do. It just needs to be encouraged. So since you probably don't have a lot of time, I also think it is justifiable for you to mix different remedies to give yourself the best chance possible. But I will tell you which ones to mix and how to mix it. Now, all of these remedies I suggest in the potency 200C. It is also sold as 200CH or as 200K. I wouldn't recommend anything lower, definitely not higher. If you can only get your hands on a 30C, then that's fine. But see if you can aim for 200. This is usually quite easy to get your hands on, either online or at a local store or homeopathic pharmacy. The first remedy is pulsatilla, and pulsatilla is all about letting go. And that is specifically when it comes to motherhood or childhood or pregnancy, anything has to do with that. So sometimes I give pulsatilla to moms that are overdue because they find it difficult deep down, sometimes they don't even know, they find it difficult to let go of the pregnancy. But by taking the remedy pulsatilla, the labor starts. Sometimes it's the baby that has difficulty letting go of mom, so the baby needs the remedy. I think it works in the same way when it comes to an incomplete miscarriage or a missed abortion. It's like the body is not ready to let go, and that can be both emotionally and physically. So if you find that you're crying a lot as well, which is really understandable in this situation, but even if you're not, pulsatilla is probably the first remedy that I would suggest for you to try. Now, ideally, you take that remedy first and you give it a chance, but if you don't have a lot of time, the second remedy that you can add in straight away is called Cicalis. And Cicalis is a remedy that I use a lot in labor as well, and that is for a retained placenta. So it is very appropriate if you have an incomplete miscarriage. In that case, maybe skip the pulsatilla and try Cicalis straight away, or just add the two together. But Cicalis is also very appropriate if you have tried the pulsatilla for several hours or several days and it's not doing enough, then you can just add that in or switch to it. What I find sometimes is that women that have a miscarriage, but it won't stop, the bleeding won't stop, it will just continue and continue, and there is still some tissue staying behind, that the reason can be grief. That you are so upset over the fact that that is happening that your body isn't able to process. If grief is a huge issue for you right now, which will be in any case, but if you feel like deep down that's the reason that your body is not making an end to this pregnancy in a proper way, then head on over to Ignatia straight away. But again, you can add it in with the other three if you think it's appropriate. But you need to justify every remedy and not just throw it together. Now, the problem with a missed abortion or with an incomplete miscarriage is the risk of infection. This is what doctors usually say. That's why you need a curettage, because it might start to infect as the tissue starts to degrade. In that case, if that is already happening, you're starting to feel very flu-like and you have maybe dark and watery discharge for a longer period of time, then Aristolochia is more appropriate to start with straight away. And there's actually a remedy for a step further even, and it's called pyrogen, and that is when you are already starting to enter sepsis. Now, hopefully you're going to be clever and you're not going to get to that point because you're going to see your doctor in time and you will likely have had the curettage already. But for some reason, should you be in this really difficult position and you have access to remedies, then pyrogen is something you really need, and that will also encourage the pregnancy to end. So it addresses both the sepsis or the infection as well as getting rid of the pregnancy. Now, if you've tried these remedies or you don't have the opportunity to try, then head on over to these remedies. Make a combination of arnica, calendula, Bellis perennis, and Stavus agria. These are all remedies that have to do with surgery, they have to do with bleeding, they have to do with healing of the tissue. This will all help in pain management and healing of the tissue, but also reducing the risk of getting adhesions and any kind of scarring that will set you up for more problems in the future. You can throw a pill of each of these in your glass of water or your water bottle and sip it leading up to the surgery, and then also sip it in a couple of days afterwards. Now, it's really up to you how much you want to sip of these remedies. You can take several sips an hour, you can sip every 10 minutes, but what I find is that usually intuitively this works out quite naturally, that you start sipping it maybe every 5 minutes and then the intervals get bigger and bigger. If you take a sip an hour or a sip every 2 hours, that's okay too. You will probably know. But do make sure that you're able to last that bottle at least throughout the day if you intend to be sipping throughout the entire day. And if you're taking the remedies to resolve the pregnancy and you notice any change in your situation, maybe you get heavier bleeding, or you get a change in color, or you suddenly get big clots, or yeah, anything like that, or you get more heavy cramping or less pain, that's a possibility too, then that means that your body has been triggered to do the healing, and then you should reduce the frequency or stop, and then pick up the remedy again later on if you feel like the process is stalling again. Because remedies are all about stimulating your body's healing mechanism, and if you repeat it too much, your body might get frustrated and be like, will you stop yelling at me with these remedies? So all you want to do is repeat the remedy as often as is needed for your body to start moving. All right, so those are the remedies that I can suggest to you to try. I wish you the very best. I send you a big, big, big hug. Take your time to mourn, and yeah, make sure to check out that other video I mentioned. And in the meantime, see you in the next video. Bye.